Okay, well, we certainly had a full 2 days with 39 speakers. I think we had in total, I counted it up, that's huge. Long days. Thank you for staying with us for the entire time. I really wanted, though, to spend a few minutes, and I will try to be brief, but to bring us back to why we came here in the first place. What we're going to do with the information we've collected in the last 2 days, individually and collectively, to advance putting living first within whatever our sphere of influence is. And we all have a sphere of influence. No one person can do it all, but each of us does have an ability to influence culture change. So what I've been doing over the last 2 days, as I've been listening, is jotting down every time I heard an idea for an activity that someone in this group could take back and implement in their community, or potentially implement in their community when they return. And I've organized them into those domains of transformation for culture change to put living first. Organizational transformation, environmental transformation, personal transformation, and societal transformation. So what you have in front of you, so those of you online will have received a PDF file, I think, from Kate Duchek, which has this checklist on it. So please look for that. So I'm not going to go through every element, but what my advice to you would be, pick no more than 8 things that you will put a check mark beside. No more than 8. You can pick fewer, but you shouldn't pick less than 8. We're not going to do it all now. I'm just going to try to synthesize some of what I heard, and I'm sure I've missed some things that you can add in the lines at the bottom. So first of all, I wanted to ask for organizational transformation. Will you take an honest look at your activity calendars using Heather Luth's 5 Whys? Will you take an honest look at your one-to-one programming? Remember that she talked about 75% of us in this room when she did the survey preferred individual leisure activities to group leisure activities. There's a group of items here. It's number 4, 5, 6, and 7 that relate to the first morning session where we went through the Putting Living First guidebook. So will you form a small group of learning partners, or if you've already done so, will you expand that group? Will you use that guidebook? Will you access our coaching and consultation services that are available? And you can contact Kate Duchek for more information about that. Will you complete that collaborative organizational assessment as an organization to see where you stand currently on those 9 domains of culture change that Rosemary Fagan identified? And then the next item relates to the conversation we had at several points during the 2 days on the neighborhood coordinator staffing structure. There was lots of interest in that, I think, staffing structure. So will you consider implementing something like that, or some form of structure that drives decision making closer to the resident, to the neighborhood level or to the home area level? And that also builds more cross-functional teams and more consistent assignment. Paul Brown at Schlegel Villages is one of the people who you can talk to for more information around that. Tamara White also is very familiar with that, and she spoke a little bit about that as well. Will you engage physicians as a more integral part of the team? And specifically, will you let your medical directors know that there's a Medical Directors for Long-Term Care training course that Andrea Moser talked about, and the next offering of that is next January. And I'm going to skip down to the bottom here, just in the interest of time. Will you engage your residence council and family council in culture change activities? And if so, how? Will you involve residents in the hiring of new staff? I thought that was a really interesting idea. to explore, and that would be entirely consistent with culture change values. I love the idea of that Resident Honor Award that Carl's dad had received and that David Kent talked about and helped to set up at Erin Meadows. Is that something you want to take back and try to implement? Under environmental transformation, we acknowledge the importance of physical transformation as well, although we didn't have a lot of focus on that. But there are some things that we can do. So will you get involved in design discussions as part of redevelopment of older homes, those of you who are part of that? Or when you're simply completing renovations or upgrades, will you think about how to put living first? And I'm thinking about the comments we had after Heather Keller's presentation on those 12-person dining rooms. And somebody said, well, maybe there's 16-person dining rooms, and there's 2 of them with the servery in between, so you can actually change up your dining configuration within a current 32-bed home area. So think about that. Is that something you can move forward on? Will you take on an initiative to eliminate personal alarms? We had some really compelling conversations from housekeepers, and Mary, the personal support worker, did a similar thing at Winston Park to eliminate personal alarms. And I will say, actually, on that one, that we had tried to do that the year prior to when these folks did it, these frontline folks, and it was a support office nursing consultant who heard the same presentation at Pioneer Network, who brought it back and tried to implement it across Schlegel villages, and it didn't take. And it didn't take because it was not a frontline-driven initiative. When it was a frontline-driven initiative, it worked. So keep that in mind too as a piece of advice. And then there's also some personal transformation items to think about. So will you continue to learn about culture change, and how will you do that? We talked several times about Pioneer Network as a powerful conference to go to. We also talked about, will you be willing to break rules in the interest of putting living first? We had some really heartfelt conversation about that. I really especially love the comment that resident rights should always trump the Long-Term Care Homes Act. And if we can anchor things in resident rights, we can make the case to our compliance advisors that this is a worthwhile approach to take. And I loved Mary's example of beer at Laurel Creek, you know, and I loved Michelle's example of the common cookie jar. These are small things, but if we put ourselves out there and say, I'm going to take that on as a way of putting living first, and I will, you know, try to educate compliance advisors, and those are the kinds of things that over time do allow putting living first to become a reality. I want to talk a little bit about the item that says, will you join the Canadian Culture Change Network? We haven't really talked about that, but I put it on the list because after our Walk With Me conference in Edmonton, which is the Canadian version of Pioneer Network, let's say, we are just beginning, that was our second national conference. We're working towards building a national network in Canada, similar to the Pioneer Network in the US, that will allow us to do more of this kind of knowledge exchange on culture change activities across the province, across the country. And I, you know, someone said culture change is happening under our feet. I think it was Joanne Dykeman, wasn't it? Culture change is happening under our feet, but we don't know a lot of what we're doing, and we're not sharing enough of that because we don't have that network formalized or terribly active yet. Kate Duchek, who at the back is our Culture Change Project Officer at the Research Institute for Aging. She will be leading that network, so please do contact her to talk about how to become a part of that network and what the different levels of involvement and membership are. We're just starting to develop it. I can't give you much more detail than that. I also was really compelled in terms of personal transformation by Michelle's story of Ruby when she said, "Are you treating me as a child?" And that to me is a moment of personal transformation too. That culture change is very much about honoring residents for the whole person that they still are. And we heard Sharon, the resident, say that as well. And we heard that in Barry Barkin's definition of an elder, that older adults are whole, they're still learning, they still want to contribute, they still want to look to the future, and they have much to contribute to that future. So part of our personal transformation is to honor that definition of an older adult, of an elder. And then societal transformation. Will you be the change by modeling these practices, by honoring residents as whole people? I just want to comment on the very last item because I put that one there, but we haven't talked about it. So will you call people out when you see or hear prejudice against older adults? And I want to share a story that I heard from Karen Stobie at the Walk With Me conference in Edmonton. She told a story about when she hears local news about, car accidents. Sometimes the local newscasters will say, the 90-year-old driver is in hospital, or the 90-year-old driver who caused the accident, is doing well, or whatever the news is. You would never hear a news announcer saying, the black driver is in hospital, or the Muslim driver was in hospital, or the Catholic driver was in hospital. So we are labeling people older in ways that we would not do with other sectors of society, or labeling them as marginalized. And what Karen does when she hears that is she calls the local news station, or she writes a letter to the editor, and she says, this is marginalizing adults, it's not, or older adults, it's not honoring them for the valued members of society that they are. That's part of societal transformation. They're small things, but if we call them out, and if we all call them out, it changes, it transforms society for honoring elders. So that's my little kind of conceptual summary of the 2 days. I hope it resonates with some of the things you've heard. I hope you can use that checklist for your own action items. I want to just close by saying a big thank you to Kate Duchek at the back, and she really has. She's the one who has been the backbone of all of the logistics behind this and getting all of these speakers together with Mary Lou Vanderhorst. So thank you very much to you, Mary Lou. And we had a team supporting her, so thanks to Darley, who's at the back there, part of the RIA team, as well as Susan Brown, Hilary Dunn, Gert Hartman, Amy Matheru, and Kate Wilson. The whole team really came together, so thanks so much for making that, making it easy for all of us, because we all shared the workload. And finally, a thank you to the Government of Ontario through the CLRI program, for allowing us to put an event like this together. And thanks to you, and safe journeys.